Hello and welcome to my channel Pet Vet. Today we are going to cover what all are the important things that you should take care after and before getting your cat neutered. A lot of people have been asking me in the comment section that, how do I take care of my pet or how do I take care of my cat after neutering? So, I'm going to cover some very simple topics, one very simple tips, what things that you should adhere to. And I'm sure that it will really help you out in, getting the understanding about this entire issue. So we'll start with quickly what is cat neutering. Okay. In simple terms, cat neutering refers to the castration or the removal of the testicles of a male cat so that he cannot impregnate a female cat. Only a veterinary surgeon can properly and safely perform this cat neutering operation. So it's always and always recommended to always visit a pet and not just any imperfect unprofessional person who says that no, I can get this thing done. All right. Cat neutering surgery includes a lot of procedures which starts with giving some multimodal analgesic pain and anti-anxiety medications to your pet. So your veterinary will generally use general anesthesia for the procedure to avoid any discomfort to be felt by the cat. So this is generally it starts with the entire time of this operation doesn't take more than 15 to 20 minutes. Okay, I have got it done for my cat, and if you just want to see where it is, he's just sitting next to me. Say hi, Joey. So, anyways, he's taking some rest because we just got it done yesterday only. So he's still in a little bit of the anesthesia, and he's sleeping. So that's a good thing actually. I mean, because of this anesthesia, it covers up to 18 to 24 hours of time. So till that, after the operation, your cat doesn't feel so much pain. So he's taking rest right now. So there's a small thing that happens after this anesthesia. The surgeon just makes a small incision in the front of the scrotum, and each testicle is removed, and in the blood supply and the vas deferens, which is the spermatic cord, both are tied off. All right. And the veterinarian then closes the incision. That's what it generally covers. So while this was just about the process of cat incision, there's a lot of people who actually ask why is the need of doing it. So first of all, as I already told you, that it is very much important because uh, see, there are two things. Either you get your male cat or female cat mated every 3 months, okay, and if that is, I know that that's not possible for a lot of people. So that the second way is to get it neutered, so that the cat doesn't feel and get excited and have showed those kind of symptoms. Because if you don't get your cat neutered and neither he or she is mating, then you will face a lot of problems. In fact, not only you, your cat will also feel very frustrated. He'll always be in anxiety. He'll always show some aggression, and he or she will start spaying or start peeing on different parts of the your home, and they'll start making their territories. It's ultimately a breed of cat, that's tiger. But yeah, that's how it works. So it's always good, it's always better for to get them neutered. All right. And if you don't get them neutered, then a lot of other side effects are also there. A lot of cat gets tumor in their testicles and even things like cancer. So I really feel that it's better, and in order to make your cat healthy, it's really good to take care of him and get him neutered. Or else, if you can't get that done, it's better that you visit some of the vets and somehow figure out to find a girlfriend for your cat. So yeah, that's how it works. That's how it works. So apart from that, I'll just cover one simple thing, like the most important thing. In fact, a lot of comments that I can see right now, people are actually asking that, what all are the things that you should be taking care of, that what all things, how you will make sure that your you will ensure that the cat is getting enough, enough care. So the first thing that I will tell you before deciding on, uh, sorry, before going to the doctor to get your cat operated. Okay, once you have finalized the dates, you know that the coming month, whatever date that you have fixed, let's say 10th of February is the date when you want to get your cat get operated. Okay, so what you have to do is, on the same day you have to stop giving your cat food and water and any such things. And that's very important, and that's very, very crucial. See friends, what happens is that a lot of people don't take much heed to that, and they say, oh, my cat is starving, and they somehow give some kind of food or water to the cat before the operation. It is really very dangerous, because when the anesthesia dose is being given to the cat, and the cat is subconscious or unconscious, at times during the operations, there are times that the food gets stuck in the airway, in the air passage of the cat, and that proves to be a very, very dangerous thing. A lot of cats must have given their life on that. So it's really important you don't forget to, stop giving your cat food and water at least 12 to 15 hours before the operation time. That's very important. After the operation, so that's the only thing that you should just take care. And of course, one more important thing, that if you have got some surgery done for your cat, or if there's some issue that the cat is facing in terms of the medical history, you should always tell it to your vet upfrontly without him asking you, so that he can take care of some other things as well, especially the medications that the person is giving it to your cat. Now once the cat gets operated, it just happens in 15 to 20 minutes. Once it is done, you are ready to take your cat to your home back. Now you just have to make sure of one thing, that the cat will be mostly sleepy, so don't put it on a heighted location. Try and assemble his bed, the cat's bed, on the floor itself, so that, and try and somehow, cage him for the time being, or at least use a collar. There are collars available in the market, so use a collar for that, so that your cat doesn't, lick the operated area. That's very important, because it can get a lot of types of infections to your cat. So, and one night especially you'll have to dedicate, and you'll have to, one after the operation happens, you'll have to take care of your cat. You'll have to sit. I actually sat down the entire night just next to my cat, and I was sleeping, but I was just after some time I was just checking my cat whether he's fine or not. And I'm telling you, even after having a lot of anesthesia, my cat even tried coming to my door, my bedroom, and then she lied there, because she doesn't have the enough strength to pull down the push down the door. But I heard some noise, and somehow I got there, and I then picked her up again, and I took her to my bed, and I was taking care of her, taking care of him. So that is important, that you'll have to take care of. Third important thing is that even after the operations, doctors say generally that at least for next 12-15 hours also, don't give any kind of food or any water to the cat, unless he's really wanting that. If he really is thirsty and wants to have some sip of water, then let it be. Even after having that, even after having some food, there are chances that your cat might puke again, but that's very normal, so that's not a thing to be afraid of. But of course, try and avoid giving some food at least for the next 12-15 hours. And once it is done, you just have to take care of simple things, like just prevent your cat, keep your cat indoors, and stay limiting the running and jumping part. Any which ways it will not do for the next 12-15 hours, then because of the anesthesia. Then preventing your cat from licking the incision site, as I already told you, which may cause infection. You can also utilize the e-collar that, as I just told you, so that can really help you help you prevent your cat to lick it otherwise. So you will also have to check the incision site on a daily basis for at least next 1 week, and whether it is healing properly or not. And even if you see any small redness or kind of swelling or a discharge at the surgery site, or if you figure out that the surgery incision is getting a little bit open, the first thing that you should do is to contact your vet and take your cat to the vet. You do not try to put any you know, band-aids, or don't do anything. Don't leave this incision site open. Take it to the cat pet vet. Take it to the vet I meant, and then they will take care of it. So these were small things that I just thought of telling it to you. And please take care of your cat and take care of yourself, guys. And I hope you enjoyed the video, you liked the video, you must have got some ideas from this. In case of any other doubts, any other things that you might have, you please write it down to me in the comment section, and I would be obliged to respond to those. Thank you so much, friends, and take care of yourself. Das vidanya.